According to clinical psychologist Dr. Alina Williams, post-COVID-19 pandemic, there has been a significant rise in mental health challenges, especially among children and adolescents.
And we notice among young people too, there's significant increases in depression, anxiety, suicide attempts, and self-injurious behavior. So our young people are finding it very difficult to cope with day-to-day life. They are experiencing undue amount of stresses at school, at home, and of course, one of the big topics now is bullying.
With an upsurge in bullying incidents being reported at schools both in Trinidad and Tobago, Dr. Williams said seeking help is critical.
When it is not dealt with adequately, it lets the victim know that there is no options, that there isn't support or help available, and that creates a sense of hopelessness, and hopelessness is also a big risk factor for suicide.
She believes there needs to be policy development to address the issue of bullying.
It seems as though there isn't clear guidelines about how it should be addressed, how to manage this behavior effectively, and the policies that need to be enforced to mitigate against the effects of it. Bullying and suicide are intrinsically linked, so we know that bullying provides a risk factor, increasing the risk of young people attempting to hurt themselves.
Commenting on cases of suicides stemming from bullying, she indicated these incidents highlight the gravity of the situation.
It's unfortunate that it got to this point, but it is a wake-up call that we all have a responsibility as individuals, as parents, as families, churches, communities, religious groups, non-governmental organizations. We all have a responsibility to manage this.
In Tobago, the calls for help for children are increasing at the Children and Adolescent Center.
There is an increase in the demand for services, especially for children and adolescents, because as I said, children and adolescents are facing undue amounts of stress, not just the pressures at school, but the pressure to perform well, the pressure to excel at exams.
Turning her attention to adults, Dr. Williams said it has been noted that there is an increase in the number of men in Tobago who are experiencing mental health challenges.
I am encouraging young men to come and deal with your mental health. We are trying to, normalize the conversation around mental health to make it less taboo. But men also experience mental health difficulties, and support is important. So we have seen an uptick in women accessing our services, but definitely I can say in Tobago, more men are reaching out.
With the numbers continuing to rise, Dr. Williams is urging persons to make mental health checkups a part of their lifestyle.
There is no health without mental health. If you take the time to take care of yourself physically and you do all that is right to exercise, eat well, meet your nutritional needs, but your mental health is suffering, you are still not healthy. You cannot have one without the other. So I would say the same way you go and you do your regular checkup, it doesn't hurt to go and check up with a mental health professional.
World Mental Health Day was observed on October 10th. I am Caricia Douglas with your TTT News Health Check.